question. On healthcare, HCMC faces an approximate $40 million to $100 million shortfall due to uncompensated care and the unallotment of GAMC. HCMC is one of the top 22 trauma centers in the country. How can this gap be filled so that HCMC can continue to serve all the people who need their expertise? Second part of the question, for the vulnerable and mentally ill people who are not stable enough to remain eligible for Medicaid or Minnesota Care and who have been dependent on GAMC, what can be done in the upcoming session to ensure they'll be able to get needed medication, care, and hospitalization?
Well, the way we get funding reinstated to GAMC is to get people out of the capital. I mean, this decision that the governor made to unallot this is really cutting off your nose to spite your face. The cost of doing away with GAMC is going to far exceed any savings that we're going to get as a state. There are those individuals that are going to, still need medical care, that will go to the most expensive places, emergency rooms for their treatment. But there are also people that have gotten out of prison, that are on drugs to keep them, mentally stable, and it's a very effective way of keeping people stable, but they're going to lose those drugs. So we're also going to incur costs in public safety. It's going to directly impact people's lives in ways that we can't even begin to imagine. So we need to make sure not only are we trying to refund those GMEC, if we can't get that 100% refunded, we need to figure out ways to deal with those individuals who are coming out to make sure that they're not going to reoffend because of lack of access to medication.